Officer. This is our COVID-19 briefing for BC for Thursday, June 11th. Tomorrow we'll be releasing a statement, June 12th on Friday, and then the next briefing from Dr. Henry and myself will be next Monday, June 15th. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nation. And with that, I'm honored to introduce Dr. Bonnie Henry.
Thank you. Good afternoon. For our COVID-19 update today, we have 14 new people who have tested positive for COVID in British Columbia, bringing our total to 2,694 people with COVID-19. That includes 917 people in the Vancouver Coastal Health Region, 1,386 people in the Fraser Health Region, 130 people on Vancouver Island Health Region, 195 people in Interior Health Region, and 66 people in the Northern Health Region. We have no new outbreaks in healthcare settings today, though we did have the one new outbreak that was identified yesterday, leaving us with 5 active outbreaks in long-term care. To date, we've had 560 people in the long-term care, assisted living, or acute care outbreaks that have been affected, including 341 residents and 219 staff. We also continue to follow a number of clusters in the community, in particular, we know that there has been a cluster related to the Coral Lake outbreak in Alberta, and that one is thankfully winding down. It is not yet over, but as we go through the incubation period, we're hopeful, if there's no more cases, that it will be declared over early next week. So we currently have 183 active cases in British Columbia, of whom 13 are hospitalized and 5 people are in critical care or ICU. We have no new deaths again today from COVID-19, and 2,344 people are now fully recovered. And there are a few things I'd like to speak to today. We have spoken before about the many unintended impacts of COVID-19 on people across British Columbia, both positive and negative impacts. And we have seen people in BC come together in kindness and support for each other. But we've also seen tragedy. And as everybody knows here in BC, COVID-19 is not our only health crisis. This morning, the BC Coroner's Office announced 170 people in British Columbia died from overdoses in the month of May. I cannot express how difficult this news has been to hear. My thoughts and condolences go out to the families and friends of those who have lost their loved ones, and I share your grief. These are our brothers and sisters, our co-workers, our sons, our daughters, our friends, our community. And the extent and challenges of these crises that we are facing, both the overdose crises and on top of that, the COVID-19 pandemic, have really stretched our resources to the limit. What we do know about these recent deaths is that there has been a dramatic increase in the toxicity of the street drug supply here in British Columbia, and it is around the province. We are not only seeing people die in the downtown east side. This is the case across BC. In southern Vancouver Island, in the interior, some of the highest rates that we've ever seen of people being affected by the toxic street drug supply. We also know that COVID-19 is forcing all of us to stay farther apart from others, and this can be very isolating for some people and gives it makes it more able for them to hide their drug use from others, even if they might otherwise have reached out for help or been very careful about not using alone. We know that using alone right now is exceedingly deadly. The alarms of people missing have not been going off because we've been staying apart to do our best to try and manage the other crises we're dealing with. It has been particularly hard in these last 3 months because we had been making such progress in addressing the many underlying causes of the overdose crises. As we know, and I've said many times, it is a very complex crisis. There's no one single cause, and there's no one single magic bullet that is going to solve that crisis. But we also know that there are a number of things that we have put in place and that we are doing that were working. And since the COVID pandemic has hit us here in British Columbia, there are a number of other things that we've put in place, including guidelines for providing people with pharmaceutical alternatives to the street drug supply. So things like diacetylmorphine and hydromorphone, and being prescribed those so that you reduce your dependence on the drug supply that we know is killing people in this province. And we know that that saves lives. We know that we've been able to increase the number of people who have been prescribed safe drugs by 150%. And those are not the people who are dying. We know that this being able to access a safe supply of drugs is one way that we can connect with people who use drugs. And it is connection that helps us address addiction. And it is connection that helps us overcome the many reasons why we use drugs. We know that it is multifactorial, that it has to do with pain, whether it's physical pain, psychic pain, whether it's emotional pain. And unless we connect with people, we don't have an opportunity to help them address those underlying causes. We know that overdose prevention sites and our supervised consumption sites work. We have not had any deaths at those sites. We know that drug checking works. It helps people to understand and take the precautions they need. We know that reaching out, that not using alone, and carrying naloxone work. We must all show the compassion that we have shown in addressing the COVID crises and the understanding for our families, our friends, and our workmates, all people who use drugs, and help them know that they can reach out for help. They can talk about this, that we have supports. We can help you. We know that as well, the safe housing that's been provided with the appropriate supports for many of the people who have been homeless, who've been in some of the very dangerous encampments, are also working to support people. Addiction and substance use are complex challenges, and as I've said, they're rooted in pain. We must eliminate the stigma and shame that leads people to be afraid to reach out, to tell their family, their friends about their drug use. And we must all do our part to protect ourselves and our communities and our loved ones. Eliminating stigma and shame, a large part of that problem is around people being afraid of being put in the criminal justice system. And I have called for this before. We must look at alternatives to the criminal justice system to support people in getting the assistance they need. We have shown what we can do to look out for one another in COVID in BC. And we know that the things that we are doing are saving lives. Today, a public service announcement has been released to let people know that support is available for you and encourage you to reach out, to connect. Call 811, talk to your provider, find a safe prescription alternative to street drugs. Don't use alone. Have a buddy, have a system. Try the app, the Lifeguard app, or call 911. Know the signs in your family and your friends. And check up on your friends. Check up on those people, those workmates that you have that you may not be seeing as often. This is another time that we need to, while physically apart, connect with each other and support each other. There are two other issues I want to talk about. One is that we've made some revisions to the order, the public health order around restaurants, including this is, as we've said, we'll update our orders as we need to, as we get some more experience. And the environmental health officers and inspectors and WorkSafe BC have been working with the restaurants around the province to understand the issues and get some clarity on the things that were working and weren't working with the previous order. So instead of a blanket 50%, what we now are requiring is that every restaurant, pub, or bar has to identify a number for their capacity that includes the patios. And this was one of the complicating things. As you're expanding your patio, how do we know what number to use? So it will be done in collaboration, and we'll have a defined capacity that will allow us to understand how better to enforce the rules. It also clarifies restrictions on the use of barriers, and those have been very effective in a number of places and have allowed some of the smaller local restaurants to open. As well, it puts in restrictions around self-serve areas and buffets that reduce the chances of transmission, and identifies some of the choke points in restaurants, and puts requirements for measures to be put in place so that people aren't congregating on the way to the washroom, for example. So these updated orders were posted last night, and the team at WorkSafe at BCCDC and our public health inspectors will be working with the restaurants around the province to make sure that they get implemented. I also want to talk a little bit about some of the announcements that came out about the NHL. There has been much discussion and commentary about the NHL and the potential to resume the season. But like the Premier and many others, I also think bringing hockey back to BC would be a very good thing. But let me be very clear. There are no exceptions to the rules or the public health guidelines that are in effect here in BC. And in no way will we compromise all the work that we have done and the health of British Columbians for the NHL or any other group. The NHL has provided a proposal for consideration by federal and provincial officials, and we have reviewed that. And let me also be very clear, this is not for today. The proposal is for potential for some time in the future, late summer into the fall. I have reviewed that plan, and it exceeds the requirements that we have in place even today, and it meets our criteria for protecting our community without compromise. Teams would have no contact with the public, with no spectators, and no families. So it is the concept that I have said meets our criteria is teams that are in small pods of less than 50, that are in what we would call a household bubble. So it would be very similar to somebody coming back to a household here in British Columbia. They would also be subject to intense screening and testing for the entire time. And it is not just a 14-day period of time. If Vancouver were picked as one of the hub cities, there would be a period of several weeks, and they would be in this team bubbles for that entire period of time. So I would absolutely consider any other proposals that met that very high standard that this proposal did. And so I have given my, we've written a letter to Ottawa based on this, and based on the understanding that we would have more opportunity to discuss it as we move forward and as the decision was being made. So this needed to be done at this time for the NHL to make their decisions, but we would, of course, the resumption of games, and again, without spectators, would be dependent on our progress and dependent on my assurance that these extreme measures would continue to be put in place so that the health of safety of everybody in British Columbia, which remains our number one priority. So we are still in our monitor, manage, and modify. It's the key to managing COVID-19 right now, keeping our communities safe, and protecting the ones we care for most. We have shown in BC that compassion, support, understanding work. They're what get us through this crisis. And that are what we need to show not only to our communities for getting through COVID-19, but also to deal with people who use drugs and supporting our communities through our overdose crises. This is the time, again, and continues to be our time, to be kind, to be calm, and please be safe.
Thank you very much, Dr. Henry. As Dr. Henry said in her report, we have no deaths to report from COVID-19 today. That's obviously good news for us and for everyone. That's Saturday, Sunday, Monday, Tuesday, Wednesday. And we are obviously pleased with that, happy with that. We also, as Dr. Henry has spoken about, received the report from the coroner service today, with respect to overdose deaths. And we know that there are the reality of the consequences of COVID-19 in society have been felt everywhere, and we see it here and we feel it here. 114 overdose deaths in March, 117 overdose deaths in April, 170. Hard to imagine overdose deaths in May. That's 401 overdose deaths over 3 months during this pandemic, which has so changed and transformed our society. And what I wanted just to say today, because my colleague Judy Darcy has spoken eloquently about this, that there's a public service announcement out there that we share it with our friends, we share it everywhere in the province, because if you read the coroner's report, you know that this is a provincial issue. We don't always think of it that way, but it is so profoundly a provincial issue, one that's felt near the Thompson River and the Fraser River on the north of Vancouver Island and in the Kootenays. It is felt everywhere, in every postal code in BC. And people in this period, and it is a challenge in this period, when we are increasingly alone and when people who are dealing with themselves, with dealing with existing isolation, may feel all alone, to think they're alone. But if you are in trouble, call 911. If you need help, call 811. If you need help, talk to your provider and get access to a prescription alternative. This is the time to do all those things and more, but it's also the time for us, as we have in COVID-19, sometimes for seniors who are isolated, sometimes for others, we've reached out. Well, we need to reach out today to the people we know and let them know, yes, that we love them, but also that the help is available for them and that they are not alone. And we know the consequences of this, and we grieve those consequences. 401 people, 3 months, 170 people in 1 month is 401 and 170 too many. And we pledge ourselves to work on both public health emergencies. I wanted to just speak briefly about some of the and provide a couple of the reports that I regularly provide on Thursday. Say that increasingly our acute care system is being used. We're seeing, as I've said over a number of weeks, a restoration of the utilization of emergency rooms, which is so important. People have to know they're open for them, and if they need the ER, they need to go, and they can go to the emergency room. In a couple of health authorities, we're up to almost 90% utilization of acute care beds. And this is reflected in the report that I have to give you on surgery renewal. And this represents a real achievement, I want to say, for the healthcare system. I want to put this in context. The week of April 6th to 12th, the healthcare system performed 972 scheduled surgeries. Those are urgent scheduled surgeries, and 1,104 unscheduled surgeries. The next week, it was 991, that's April 13th to 19th, 991 scheduled, and 1,238 unscheduled surgeries, for a total of 2,229 in that week. That number, since we relaunched scheduled or elective surgeries in BC, has gone up to 3,963 in total, the week of May 18th to May 24th, to 5,329 in total last week, to 5,955 in total this week. That number approaches the 6,000 surgeries we typically do in the course of a typical week, and represent 4,588 scheduled surgeries and 1,367 unscheduled surgeries. In terms of scheduled surgeries, that's 4.5 times what we were doing in the middle of April. And it represents, I would say, extraordinary work by people in our healthcare system, extraordinary work that I want to give them all credit for, because it is very important. I also wanted to say that the call-out progress is being made of people in need of surgeries or who are on surgery lists, that the priority in those surgeries continues to be urgent surgeries, surgeries with waiting times of less than 4 weeks, patients who've had their surgery postponed, and patients who have waited more than twice the clinical benchmarks. That's our initial focus in this surgical plan. You know that 34,435 patients have been contacted. Some of those patients, a small number, about 908, have expressed an unwillingness for or are unavailable for what's a COVID-related reason. Either they don't feel it's the appropriate time to go in to their surgery at this time, or they have concerns about that. 908 out of the 34,000. But in general, people have been willing and have been anxious, in fact, to proceed with their surgeries. And I have to say the system has responded extraordinarily well. I want to briefly speak about the single site proposal. There's not a lot of change since last week, except one change in the number of sites that it applies to. Island Health has determined 20 of the sites that they had explored and they've been looking at are not in fact subject to the single site proposal. So the number of sites is down to 500 to 503 in total. That's 23 sites in Island Health. Of the 26 that they hadn't done where the order actually did not apply, they were not the facilities to which it had applied. So we have now 10 facilities left, 493 done, 503 in total, 10 facilities left, and approximately 300 staff who still have to be transitioned from one or more site, more than one site, which is 96% complete. And it's our expectation that those 10 remaining sites will be completed in the very near future. I hope to report on that next week. It is an extraordinary achievement, I would say, for the system. There are 48,794 people at affected sites. Working through the challenges of contracts has been a considerable challenge, but I'm happy to say that that work is happening, and that around in the coming 2 weeks, we're expecting people to see the increase in pay for those people who are below the ABC standard and to whom the order applies. So that work, which is really in some ways unique in the country, the success of this initiative, its comprehensiveness, its completion is unique in Canada, and we're very proud of both medical officers of health, of the provincial health officer's office and team, but all the health authorities, all the unions, all the employers who have been part of this effort in BC. I want to say finally that this is, I think this week demonstrates some of the challenges we face in the future with COVID-19. We live in a province, of course, and we are pleased that we've had some positive results on COVID-19 in our province in the past number of weeks, a reduction of flattening of the curve. But we live in a country and we live in a world as well. And I think Dr. Henry noted on Tuesday that we had seen on Monday a record day for new cases of COVID-19 in the world. This is a record week of new cases for COVID-19 in the world, just to put it in context. The high number of cases in India was June the 9th. The high number of cases in Brazil was June the 1st. The high number of cases in the world was June the 8th. The high number of cases in Oregon, not far away from us, was June the 8th. The highest single day number of cases in California was June the 5th. The highest single number of cases in Arizona was June the 6th. In other words, COVID-19 is with us, and we have to continue to work together over the coming months to address it. That our situation in British Columbia is not necessarily typical of what's happening in the world, but because COVID-19 is in fact present and in fact growing in the world, means that we continue to have to be vigilant here in British Columbia, both vigilant in terms of our borders, but also vigilant in working with everyone else on what is ultimately a world problem and will have to disappear as a world problem no matter how we do or how well we do in British Columbia. As we embrace here all that may be possible under our renewal, we must consistently use the skills that Dr. Henry and our public health officials have taught us. The life-saving skills and practices that so many in our neighborhoods and community are counting on us to use to keep them and their loved ones safe. This is not the time to be stepping back from that. Physical distancing saves lives. We must keep physical distancing as our constant companion. That doesn't mean we lose sight of one another or stop connecting with another. We just have to continue in the new normal to find ways to do it. Whether it's to defend against a second wave, which may well come, we expect it to come, or present a resurgence before that. Our greatest chance to protect ourselves, our greatest defense against setback, is to renew our commitment to stopping the spread. And we need to do that this weekend and in the days, in the weeks, and the months that follow. The key to our BC renewal is us. We must continue to be 100% committed to stopping the spread. Aujourd'hui, nous annonçons 14 nouveaux cas qui ont testé positif pour COVID-19 pour un total de 2694 cas en Colombie-Britannique. Il n'y a eu aucun décès lié au COVID-19 pour un total de 167 décès en Colombie-Britannique. Nous continuerons à offrir nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 13 personnes sont actuellement hospitalisées, dont 5 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. À ce jour, 2344 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Thank you very much. Merci beaucoup. We're happy to take your questions.
As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question only. I would also ask that you please take your phones off mute. You will not be audible until I call your name. First question is from Binder Sudjan, CTV.
Hi there. Minister Dix, this is for you, and Dr. Henry, if you'd like to weigh in as well. But there are people who are saying with the overdose numbers that were released today that what they would like to see is a comprehensive strategy with both the federal government and the provinces to deal with the issues, and particularly around safe drug supply. And I'm just wondering, I know BC has done some work, but how far do you think it is away for us to see a comprehensive strategy similar to that?
Well, I absolutely think we should still be advocating for that. That is something we have advocated for a long time. I had a discussion with my colleagues across the country again this morning about this very issue. We have had established a special advisory committee similar to what we have for COVID-19. However, it has taken a bit of a backseat during the pandemic. But the issue that we're dealing with, the one major underlying driver of the numbers of people who have died in the last few months has been the dramatically increasing toxicity of the drug supply. And that has to do with the same thing that's interrupting supply chains for other issues, and that's border issues, more challenges getting product in, and things are becoming less available and therefore more expensive and more toxic. And that is not unique to British Columbia. We're seeing that across the country. So we have committed to once again talking about these issues together across the country. We have, as we've reported on, started our, we've had new guidelines. We've ramped up our access for people who use drugs in British Columbia to receive prescription alternatives. It's been slow starting, and I've mentioned this before, and we need to have the supports for clinicians, and there's now a 24/7 line that clinicians can call to get advice on how to do this, and we're looking at ways that we can make it simpler for people based on protocols, so that you don't need to have a meeting with a physician and a prescription. So those are things we're working on, but there are many other pillars to it. As we know, it's not a simple question. So revisions to the Controlled Drugs and Substances Act that take away those criminal penalties for people who use small amounts of drugs for their own use. We know that addiction and substance use disorders are not things that are solved by involving people in that wheel of the criminal justice system. We know there are many other things that we need to pull together, and we had been doing fairly well on this. We were making progress here in BC and across the country. So yes, we have committed to, at least at my level, to restarting those important measures and conversations.
I think, Vinder, that's what we've been doing. That's what Minister Judy Darcy and a whole team of people that's included the provincial health officer and medical officers of health across BC are doing. And what this tells us is how difficult that task is when the terrible things, side effects of COVID-19 is there had been steps being taken that were improving the situation, not making it better because there were still vastly too many people passing away or dying from overdose or deaths in the province even before March. The numbers weren't great, but they're certainly better than what we've seen. So absolutely we need a comprehensive strategy. In fact, you're seeing, and you've seen the elements of that, taking away the stigma, a significant campaign led by Judy Darcy, but by so many other people in society, improvements in services. There's very significantly more people on prescription alternatives today than there were just a couple of years ago, and we have to continue to make progress. We've made changes even during the COVID-19 crisis in terms of access to prescription alternatives that will work for people. And we have to ensure that they see that change on the ground, and that change seems reasonable to them. We have to, in some ways, make it less challenging to get access to those things. These are all issues that Judy Darcy has talked about at length and talked about today. But there's an urgency to this moment as well. There's a toxicity in the drug supply now that is profound and significant and causing death, and we have to reach out today, right now. We need a comprehensive plan, yes, and we've in fact seen that in action, and we're going to continue to do that. But we also have to take action in the here and now to deal with what is a crisis of right now, an urgency of right now to deal with it. And so that's why we encourage everyone to reach out right now, to hear the public service announcements, to reach out for help from the healthcare system, because we are here to do that. Final thing I'd say is that these issues are, of course, not in isolation from other societal issues. And the need to provide supportive housing, the kind of response we've seen to encampments in the last number of weeks from the government, are obviously needed to support people beyond that and in other communities. Because if you see what we saw today, you saw a problem that exists in Kamloops and in Prince George and Cranbrook and in Campbell River. And so we can't just have, although it's important what happened in Oppenheimer and at Topaz and others and other places during this period, we obviously need supports across the system. So I think what's been developed is comprehensive. The question is always is it enough? And that's what Minister Darcy is driving for. Should the federal government be involved? You bet they should, and I think we're working with them all the time.
Next question is from Moira Witten. Tai.
Hi, Dr. Henry. It's been 15 months since you called for or recommended, for illicit drugs to be decriminalized for personal use. Are you renewing that call today? And Minister Dix, are you supporting and committing to implementing that recommendation?
So I'll just correct you a little bit. What I've called for is decriminalization of people who use drugs. So it's not the drugs that we're talking about. We're talking about people who use drugs, who have small amounts for their own personal use, not being criminally charged. And that's what the Criminal Code of Canada requires right now. But I believe there are ways within BC that we can have de facto decriminalization, and some of those we see already in place, where people don't face criminal charges, they may face administrative issues, they may actually get the support that they need to understand the issues that led them to use drugs in the first place. So we're not talking about the dealers, we're not talking about the manufacturers, the people who are making money off people who use drugs. What we're talking about is having alternatives to the criminal justice system for people who use drugs and have small amounts for their own use. And I will say that in defense of Minister Dix, this is, of course, an issue for the Minister of Public Safety and the Solicitor General, and I know that they have been considering it, and we've heard the response that it is absolutely a federal criminal code act, and we do want action at the federal level, and I've been calling for that and will continue to and renew that call today for action at all levels.
I mean, I think it's very clear that criminal code is a federal responsibility, but it's also clear that should the federal government make changes, we have to respond. And that's what happened in March, I think it's fair to say. That partly reflected changes from the federal government, and we acted expeditiously to respond to that, because clearly this is a public health emergency that requires a series of actions, not one, but a series of actions. We need a comprehensive plan, and there's a significant role. And if you're asking what role can the federal government play, they have to review their positions and work with us to make this happen. And you know that Minister Darcy is prepared to do that any day of the week. So my colleagues, Minister Farnworth, Minister Darcy, are on this file, fully engaged in this file, working with the federal government, but also not waiting for that. And the changes you've seen, even in the past 2 months, show our determination to take action, both in terms of providing supportive housing in communities, in changing issues around access to safe prescription drugs and others. And so we're going to continue to do that. I'm very committed to that, very committed to working with Dr. Henry and supporting my colleagues as they do this work.
Tanya Fletcher, CBC.
Oh, hi there, Dr. Henry. It looks like you've amended the public health order for restaurants as well, confirming that buffets and self-service areas are allowed to be open. I'm a little surprised to see that. We kind of had the impression that that might be one of the least safe options that would reopen later on, if at all. How can you be positive those areas will be clean enough to be safe? And I know they are required to have hand sanitization stations around, but that's kind of a voluntary thing, isn't it?
No, it's not a voluntary thing. So it's one of those technical things. They were never not allowed. They were not recommended, and we had guidance around that. So what this put in place was, if you have self-serve stations in particular, so we still, there needs to be ways that it's very explicitly lays out what you need to have in place if that's the type of thing that you have in your restaurant. So it is not in any way allowing something that was disallowed before, but it's putting in place the restrictions that need to be in place for them to operate.
Next question. Oh, go ahead.
Sorry.
Next question is from Richard Zisman, Global News.
Dr. Henry, on some of the things you just mentioned on hockey, and thanks for taking the question, I'm unclear on what part there are about families. You mentioned will hockey players not be able to bring their families when they're coming to play? What sort of requirements will there be for testing? What would happen if someone connected to the hockey bubble ends up either testing positive for COVID-19 during the quarantine period or after? And then on youth sports, we had some news on that yesterday from the Premier. Are you still concerned about what youth sports looks like and recreational sports looks like this summer?
Well, let's start with the recreational sports. Absolutely. We want youth sports to get going this summer. That's really important. We know there's a balancing of risks here, and that is one of the lower risk activities, and we know it's good for health, both physical health and mental health. But it needs to be done in a way that protects the children, the people who are involved. So there are guidelines coming out that will take those into account. So it will look a little different come the summer. So all of these guidelines are things that we have been working on with WorkSafe, in some cases with the sport federations, in other cases we've been working with some of the national organizations to make sure we have an approach that meets those needs. And so I do absolutely think that youth sports will be coming very soon, and they'll be safe. But they will be different. There'll be smaller numbers of people. There won't be the spectators that you're used to. And there'll be ideas around how teams can have local tournaments and games, etc. With respect to the NHL, yes, they have a very detailed plan for their hub city model. And once they get to that point, it's that phase in the in their proposal, and I will say that this is all a proposal, and that there was a requirement to see if these would meet potential criteria for something that would happen much later in the summer. And the proposal is absolutely that there would be small numbers for each team, under 50 and likely less than that. So in terms of trainers and coaches and players, the number would be small. They would be in their bubble for the entire time that they're here, so not just 14 days. It would be maintaining essentially a work quarantine or a modified, like we have, for example, with temporary foreign workers, with some of the other workers that we have here, or if people are coming home and in a family environment and quarantining in their family environment. So they had a very rigorous testing protocol, but more importantly, they have a screening protocol that reviews health status every day, multiple times a day, etc. And then it would be, they have proposals for where people would stay. They would be in separate areas without mixing and mingling with other teams, as well as transportation to and from the facility. So it was a very detailed, well thought out plan that did not involve families coming for the players at that time. It also included how all the different people that would make it work would be in minimum numbers, etc. So I was confident that if we're at that point when we could allow that type of an event to happen in August or September, that Vancouver would be an appropriate place to do that, and we could do it meeting those criteria very safely. The other part of it, of course, would be the partnership with public health. So if somebody did test positive, there would be a plan for how that team would all be isolated, like we do for other settings where people would all be tested, and we would have a plan for managing that individual. And there was the possibility, of course, and this is, I think, what the NHL was most concerned about, if people do test positive once they're in that bubble, that could affect the entire tournament. So there was provisions for what would happen with that. And as I've said, we're figuring these things out as we go, and we're modifying them as we see things in our community, as we're moving, as we're looking at the levels of transmission in our community. So we will continue to monitor this, and we'll see what happens. And I think, it would be the amount of time and effort that was put into developing a safe proposal, I was impressed with.
Next question is from Mary Griffin, CHEK News.
Hello?
Yeah. Hello. Just a question on why you think the numbers that came out today on the opioid overdoses are so high for Vancouver Island and Victoria in particular, and what measures can be taken to make sure that June's numbers and the numbers going forward do not continue to increase? Thanks very much.
Yeah, I wish I knew the answer to both those questions. We do know that South Vancouver Island did have a very high rate number of people who died. And we know that it is, they're not the only part in the province. And as we've mentioned, it reflects the fact that the drug supply is increasingly toxic around the province and across the country. And that has to do with where it's being manufactured, what it's been cut with, what's coming in from where. The normal supply chains have been disrupted. So that's a large part of it. We also know that leading up to May, there was a lot of issues around Topaz Park, around Pandora, around some of the concerns that we had, and that those became dangerous places. And we know there was overdoses at Topaz Park. And that's one of the reasons there was a public safety order to find safe housing for people. But the important piece around the safe housing and the plans that we enacted around that was ensuring people had access to things like were offered pharmaceutical alternatives to the street drug supply if they qualified, if that was what they needed, had the mental health and health supports, as well as a safe place to stay and food, etc. So those are really important. We've not seen any deaths in the safe hotels that people have been put in, either here or in Vancouver. So I think that speaks to the importance of putting in these measures that we have. But the other really important group of people that we are seeing are young people, particularly men between the ages of 20 and 39, who are dying alone at home. And so those are the people that we need to reach out to. We need to reach out to our friends, to our family members, and talk about this. Let them know it's okay to talk about their drug use, because it's using alone that is incredibly dangerous right now. And if I don't know that my family member or my loved one is using drugs, I can't be there for them if they're using. So we need to be able to reach out to each other right now. That is the single most important thing that we can do right now to support people who are using drugs and using a supply that is so toxic.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry. Thank you so much for talking to us today. I know it's been an emotional day for you. I'm hoping to get some clarification on the restaurant order that was lifted yesterday. What does that mean for groups that are trying to plan drive-in festivals and concerts this summer with more than 50 cars present? Is this something that also applies to them?
No, the order was not lifted. The order was modified. This is what we've said we would do. We would try things out. There were things that were not working, so we modified it to make it more clear for the owners and operators of the restaurants and pubs, and for the inspectors, both WorkSafe inspectors and the public health inspectors that go into the restaurants and ensure that they're meeting the criteria. So it is not a change. It's not a lifting of the order. It's a modification to bring more clarity and to put in more restrictions around and designations around things like the patios, because that was something that was new from when we put the previous order in place, as well as more details about barriers and how barriers can be used effectively. And that came from the people on the ground who were doing the inspections, and from restaurant owners who said, you know, how can I manage this with barriers? As we know, those are very effective in terms of prevention of transmission, which is what these orders are about. They're about the best things that we can do in different environments to prevent transmission of this virus. And so this is a modification of the order that was based on the experiences that we're going through.
Next question is from Lisa Cordasco, CHLY.
Very much. This is a question for Minister Dix. The overdose crisis was declared 4 years ago, and ever since then, many on the front lines have said that a huge part of the problem is the lack of a continuum of care. What is preventing your government from spending the money needed to ensure that there is a continuum of care when it comes to rehabilitation?
I will speak first just to say that that has been one of the overriding things that we've been working on with the Ministry of Mental Health and Addictions, to try and put together, as my predecessor said, you know, you can't fix a system when there was no system there. And there was a lot of pieces, and it was very challenging for people to navigate those pieces. We're not where we need to be yet, but we are making progress in trying to pull a system together. And this is one of the things that we have worked so hard on in the health authorities with the Ministry of Mental Health and Addictions and the Ministry of Health, is to try and understand the person's journey when it comes to substance use disorder and addictions, and how we can best support people to understand the underlying causes, and then find them, help them get to a place where recovery and a path to recovery is in sight for them, or is a possibility for them.
I think in a number of areas, Lisa, especially for people who are sometimes described as street entrenched, there have been some significant steps taken in terms of housing and supports to that housing. But I think today's report reflects the complexity of these issues, that at its core, and you hear Dr. Henry speak of this, or hear many other people who are working in our system on this issue, at its core is pain. but there is a diversity in need and requirement and demand and support. It's why it has to be and has been and has been pursued as a government-wide initiative led by my colleague Minister Darcy. So you've seen that in many areas, and to say that there's more to do is to just say what's true, but significant things have occurred. Some of those things we're making progress with respect to overdose deaths, I think you could say, but they've been significantly disrupted in this time, and we just have to keep going. The initiatives that have been taken even in this time, the action that was taken to house people without housing, the supports that they have received in that housing, the changes that we've made in ensuring that people have safe alternatives, and those changes have started and they've had a positive effect, but they haven't been felt sufficiently in communities, and the needs of different communities are different. So you need, so this is a diverse problem. The people involved in struggling with it are themselves diverse, and it involves many solutions. So you're quite right. There needs to be a continuum of care, but that continuum of care is going to look very different for different people struggling with pain, whatever the source of that pain might be, and who are dealing with this overdose crisis personally.
We have time for one more question. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Andrea Wu, Globe and Mail.
Hi, I was just wondering how many people are now on BC's pandemic prescribing program, and when we might be able to expect the rollout of a more protocolized iteration of it that you had mentioned a while back, where prescriptions from physicians might not be required.
I can get you the exact number. Last I looked at it, it was about close to 2,000 people who were on prescription, mostly hydromorphone, but I'll get you those numbers. I can't give you a time frame. It is something that we're working on. There are a number of different barriers, but I expect it will happen in the near future.
That's
Thank
all
you
the
very
time
much.
we have for today. Thank you.
Thank you.